COVID rates have spiked 71% in the WHO's latest weekly count, hitting a record 9.5 million cases now. The number of weekly deaths, though, have declined, so that's good news. As cases continue to rise worldwide, though, many countries are implementing mandatory vaccinations. In Italy, anyone over the age of 50 must now get vaxxed or risk being fined. In France, members of parliament just passed a controversial vaccine bill that requires people to be fully vaccinated in order to enter restaurants, theaters, or other social settings. Anyone who uses a fake pass risks a fine and even prison. That comes just days after the president there was quoted in a French newspaper as saying he wants to piss off the unvaccinated in order to get them to get the shot. Back here in the U.S., the White House and United States Postal Service are reportedly almost ready to start shipping 500 million coronavirus test kits to U.S. households as soon as this week. All that as cases of Flurona, a combination of the flu and the coronavirus, have now been detected in Florida, California, Kansas, and Texas. The NFL has just begun looking at potential alternative sites for next month's Super Bowl, which could, should COVID make it impossible to play it, at the indoor SoFi Stadium in Los Angeles. The Grammys also announced for a second year in a row, they'll be rescheduling their awards show that was supposed to air live on January 31st in Los Angeles. No new date has yet been revealed. Joining me now to discuss all this and more is infectious disease physician, Dr. Peter Chin Hong. So, Dr. Chin Hong, first question, what is Flurona?
So Flurona is a new term and it's trending, but it's not a new concept. It's somebody, one person, who is both infected with COVID and with influenza at the same time. And, this was not a new thing. This has been described from the beginning of the pandemic in the United States. It's just that it has a catchy new name now. And because we're expecting more flu, people are getting a little bit nervous.
Thank God, because I for a moment, I thought that this was somehow the viruses had merged and created another virus, but that's not it. So good, let's check that off our list.
No.
So the Washington Post is reporting that the White, right. So the Washington Post is reporting that the White House and United Postal Service are almost ready to ship 500 million at-home test kits. Maybe as soon as a week from now. How important is it that we get those test kits out into people's homes? But also, if we get 500,000 in-home tests out, does that further muddy the waters around bookkeeping about how many cases exist if people don't report those cases?
Well, the answer is yes and yes, Charles. I think that people are relying on these tests so much, but they're not necessarily reporting them to the authorities. And I think it's sort of like we can look at the shape of the graph as it goes up and down, but we don't have as much confidence in the absolute numbers. With that said, though, I think some people are saying, well, maybe we should focus on hospitalizations and deaths, not necessarily on cases, and think about using the tests as prevention. However, 500 million doesn't really go too far in a country of 330 million. One Binax assay kit contains 2 swabs and, people go through them a lot, and we want them to use them a lot because, again, it's not just for diagnosis, but for prevention.
The last question here, which is just about human nature, would people be more likely to just not disclose and go about their business if they felt like they weren't symptomatic and they just couldn't afford to miss those days from work or miss those days with the kids, and they did, and no one knew? The only people who knew were them.
Exactly. It's like the tree falling in the forest and nobody knows it except you who's there. That is what one of the downsides maybe of having a private test is, because you don't exchange any information with anyone. No one can contact trace. But again, I think the benefits of having widespread available testing is that people would know the truth, and maybe most people, maybe not all, will try to isolate themselves from the society. But in terms of not having enough diagnostic tests, there are probably tons of people walking around. Maybe they have a cold, they couldn't find a test, they don't know, they're afraid of missing work, not bringing home money, and these are all real issues that we have to deal with. As long as we consider
Right.
and we have unvaccinated people, because we know that as vaccinated folks, we're not going to get very seriously ill. Much of what we're doing is for fear of transmitting it to people who are vulnerable, and therefore, that is the continuous loop that we find ourselves in.
Dr. Peter Chin Hong, thank you again for joining us tonight, and thank you for all of your service, sir.